The video illustrates an AI-powered workflow within a hospital information management system, HIMS, designed to support decision-making, personalized care, and continuous improvement through a doctor-patient feedback loop. Here's a detailed explanation suitable for an HIMS AI mentor. Brain HIMS AI System Flow Explanation. Large orange diamond input layer, data collection. These blocks represent the initial data inputs collected from different stakeholders in the healthcare environment. 1. Doctor observations. Clinical impressions, symptoms, test results, and hands-on examination insights by doctors. These are qualitative and quantitative insights that kickstart the diagnostic process. 2. Patient feedback. Subjective input from patients regarding pain levels, treatment responses, emotional well-being, etc. Enables patient-centered care and supports empathy-driven healthcare AI. 3. Clinical records. Structured historical data including past diagnoses, medications, lab reports, allergies, and comorbidities. Crucial for longitudinal analysis and recognizing chronic trends. Red circle hidden layer 1, data fusion. Function, integrates and synthesizes structured and unstructured data from all input sources. Role in AI, embeds multi-source data using vectorization, normalization, and semantic alignment. Outcome, a unified dataset prepared for advanced pattern analysis. Red circle hidden layer 2, pattern recognition. Function, identifies clinical patterns, correlations, or risk clusters using AI models such as CNNs, RNNs, or DNNs. Role in AI. Uses past datasets to predict disease progress. Flags anomalies or early signs of deterioration. Example, AI might notice that patient complaints of dizziness and blurred vision are commonly linked to a specific medication side effect. Orange circle hidden layer 3, treatment prioritization. Function, ranks treatment plans based on urgency, effectiveness, and patient-specific constraints, example allergies, co-conditions. AI approach. Decision trees or reinforcement learning may be applied to simulate multiple treatment paths. Clinical impact, optimizes use of doctors' time, critical care beds, and emergency interventions. Purple heart output layer, final actions. Each output flows from AI analysis and supports hospital operations and care decisions. 1. Diagnosis plan. The AI suggested diagnostic strategy, example next tests, differential diagnoses. Aids clinical staff in verifying or adjusting human hypotheses. 2. Individualized patient care. Customized therapies based on genetic, psychological, and historical factors. Powered by predictive analytics and evidence-based medicine. 3. Resource allocation. Ensures optimal use of medical staff, ICU beds, drugs, equipment, and time slots. AI factors in urgency, risk level, and available hospital infrastructure. Repeat button feedback mechanism, doctor-patient feedback loop. Purpose, ensures real-time learning and model improvement. Components. Reintegration of patient outcomes and doctor reviews back into the AI model. Enables adaptive learning, where AI continuously fine-tunes recommendations based on outcomes. Benefits. Enhances clinical accuracy. Builds trust in AI decision support. Supports ISO 21001-like continuous improvement in healthcare quality systems. Direct hit mentors takeaway. As an HIMS AI mentor, your goal is to explain this model by bridging AI logic with clinical practice. Layer clinical perspective AI mentor view. Inputs raw data sources feature vectors and NLP parsing. Data fusion patient synthesis feature engineering. Pattern recognition clinical expertise model inference, CNN, RNN. Prioritization triage system optimization algorithms. Output doctor tools decision support system. Feedback loop outcome evaluation reinforcement learning feedback. White heavy checkmark teaching tips. Analogy, compare this model to how a senior doctor integrates nurse notes, patient complaints, and test results to make informed decisions. Mentor activity, ask ments to simulate how the feedback loop works using real case studies. Explain AI ethics, emphasize the importance of data privacy, bias mitigation, and model interpretability in healthcare. Thanks for watching the video.